Arterial blood gas. Step 1. Washed hands. Items 2 through 4 can be done in any order. Step 2. Checked all necessary equipment was available and ready to use. Step 3. Students dated.
I'm confirming the patient's identity with at least 2 identifiers and performing a timeout.
Step 4. Put on examination gloves. Step 5. Identified location of radial artery. Palpated pulse lateral to flexor carpi radialis tendon. Thumb may not be used for palpation. Assessor prompt. Describe and demonstrate the steps in the Allen's test. May use instructor's hand or task trainer. Student verbalized following steps in noted order. Step 6. Held patient's hand up and had patient clench and unclench hand several times to drain blood from the hand. Step 7. Compress the radial and ulnar arteries while patient was clenching the hand. Step 8. Lowered patient's arm and had them relax and open their hand. This action alleviates tension, which can cause inaccurate results. Step 9. Released pressure on the ulnar artery and observed for brisk return to color of hand. Step 10. Assessor prompt. Describe potential results. Student response need not be verbatim.
A positive result is if color returns to the hand in 14 seconds or less, and then we can continue on with the procedure. A negative result would be color returning to the hand in 15 seconds or more, and then the procedure must be aborted and we must consider doing the procedure elsewhere.
Items 11 through 13 can be done in any order. Step 11. Prepared area with 1 chlorhexidine gluconate in a back-forth, up and down motion until area was completely wet. Alternatively, an iodophor swab can be used in concentric circles moving outward. Students stated,
the solution must stay on the site until it is dry before I puncture the skin.
Step 12. Using a heparinized syringe, remove residual air from syringe. If a cap was present, it was removed prior to removing air, and needle attached to syringe if it is not pre-attached. Step 13. Slightly adducted arm and dorsiflex the wrist approximately 30 degrees. Assessor may prompt, how would you position the arm?
I would like it slightly adducted and dorsiflexed at about 30 degrees.
Step 14. Palpated artery with index finger of non-dominant hand without contaminating, proximal to planned puncture site. Step 15. Inserted needle bevel side up at a 30 to 60 degree angle to the skin and advanced into artery. Step 16. Assessed for flashback of blood into the syringe, then allowed syringe to filled, about 1 cc. Assessor should tell examinee that a smaller amount is sufficient for the purpose of the exam. Step 17. Place 2x2 gauze pad over puncture site, withdrew needle, and engage needle safety device if present. Step 18. Removed needle from syringe and disposed of it appropriately. Place cap on syringe. Step 19. Assessor asks, how long should pressure be applied to puncture site? Student response?
At least 5 minutes.
Step 20. Slowly inverted the syringe 10 times and then rolled between palms to mix. Items 21 through 26 can be done in any order. Step 21. Disposed of used supplies in appropriate containers. Step 22. Placed Band-Aid on puncture site. Step 23. In the patient's presence, label the syringe and place in a biohazard bag. Bag should not contain ice. Step 24. Assessor asks, what must you do once the procedure is completed? Student response.
I'm going to document in the patient's chart, and I'm going to include the location of the puncture site, the results of the Allen's test, and whether or not there were any complications.
Step 25. Patient comfort was a priority. Step 26. Maintain cleanliness of site throughout the procedure.